Thanks again for coming back on the show.
Of course, my pleasure.
Yeah, now, as far as kids in chiropractic go, a lot of parents don't know, but there are advantages to having your children take advantage of chiropractic care, right?
Absolutely. My children have been adjusted since a very young age. I mean, it wasn't like as soon as they came out or anything like that, but it was a matter of keeping them checked.
Yeah.
And you're right, a lot of parents don't think it's appropriate, or they think it's going to be kind of scary, or they think it's going to hurt the child. And really it doesn't, and it's really best to have those kids checked when they're very young, because there's a lot of conditions that you can either stop or slow down if you take care of it quite early in their lives.
Now, what are some of those conditions?
Well, one of the big things is, well, we have a lot of kids that suffer with headaches, which we've talked about on a different program. Scoliosis is a real big concern with parents these days. Affects about 2 to 3% of the population, which doesn't seem like a lot, but 300 million people, that gets to be a lot of people. A lot of times scoliosis is asymptomatic. They don't have a lot of symptoms with it, but sometimes, you know, about between the ages of 10 and 14, they start noticing it's more of a cosmetic thing. They start noticing a low shoulder or a shoulder blade sticking out on one side or on the other, and then they start having some back pain or something like that. Chiropractic care has really been shown to help with that type of thing. The problem is that you have to catch it early. Yeah. Once those kids stop growing, 21, 22 years old, there's very little chance that you're going to straighten that, and no chance that you're really going to be able to help them after that period of time. You can help them with some symptomatic relief. But there's a lot of things that come with scoliosis, like respiratory problems and really even heart conditions. Some of those things, the nerves that come out and go around to the heart, come out in that middle part of the spine. And so there hasn't been enough research on that yet, but we're thinking that there's some downstream effects of that later on.
So how early would you recommend?
My youngest patient that I ever had was 4 months old.
Wow.
So how early do you want your kid to be as healthy as they can be? And I'd say as early as them coming out. I think that's a very good idea. Does everybody need to be adjusted? No, absolutely not. But we certainly want to make sure that we, at the risk of sounding cliche, nip it in the bud there and make sure that we correct the things that need to be corrected as quickly as we can.
Now, how can we get in touch with you guys?
Just call the number that's on the screen or contact us at our website. We'll be happy to help.
Perfect. Thank you so much.
Thank you.